Hello, everybody, and welcome here today because of your concerns of someone you know having Tay-Sachs. It is important to know what this genetic disorder is. Tay-Sachs is a genetic disorder that is inherited over time that destroys nerve cells, which are neurons in the spinal cord or brain. This happens because Tay-Sachs affects a gene called the hexagene, which codes to make a specific enzyme vital to the brain and spinal cord. Tay-Sachs happens when there are mutations in the hexagene. It is most common in infants, thus all of you being here today. Your infants would have looked normal for about 3 to 6 months. When it starts, muscle movement weakens. Infants lose motor skills, preventing them from turning over, sitting, and crawling. Seizures are also common, as well as vision loss, intellectual disability, hearing loss, and even paralysis. In order for an infant to inherit Tay-Sachs, both parents must have been carriers, though not showing signs or symptoms. Doctors confirm an infant having the disease by asking for symptoms and any hereditary family disorders. The doctor will also examine the eye. A child with Tay-Sachs eye will reveal a cherry red spot at the back of the eye. Medication can also reduce the child's symptoms, but there aren't any treatments or cures to Tay-Sachs. The baby will stop interacting with people as much, develop a staring gaze. Normal noise will startle it. By 1 year in, the baby may become blind. They will develop an inability to breathe and swallow. Sadly, from this affected hexagene, the baby will die around 4 years old, and the prognosis of Tay-Sachs is certain death. If I could help in any way, I'm here. Just ask anything if you need something. If you are wondering when was this disease first discovered, here's your answer. In 1881, a British man named Warren Tay, who studied treatment and disorders of the eye, studied a cherry red spot in the eye of a 1-year-old with physical disabilities. 15 years later, in 1896, an American in the field of disorders of nerves in the nervous system, Bernard Sachs, studied an extreme swelling of neurons from an autopsy. It wasn't until the 1960s when Tay-Sachs was officially identified and given its name.